What's up, guys? Tristan with Cairo Sushi and Black Diamond Club. And I've been saying for years that dentists have been doing it right, and chiropractors should look to them when it comes to a couple things: the checkup, and another important area, which is recare and recall. For some reason, dentists just get it right. They have the systems in place, they understand the business, the metrics. And I'm going to kick it to an old school legend on here who's got 43 years of doing this in practice and learning from other greats, Dr. Richard Downs from Sleep Balance Academy. So, Rick, tell me about what you see chiropractors should be doing from your side of the fence from 43 years in dentistry.
That's a good question, Tristan. And yeah, dentists have been known for this for a long time. And I think it's been out of necessity because we know how important it is to maintain your oral hygiene and clean teeth. And so I'm going to talk about a couple of things here. I'm going to talk about what we've done traditionally, what I've learned from other practice management companies that I've worked with. Many different sources for this information. I'm going to summarize what dentists do. I think it can be applied to chiropractic care. And I'm going to provide this little outline that I'm going to go through to all the participants here with this video series that we're doing on recall and reactivation. So would you like me to get going on that?
Let's rock.
All right. So let me just bring this up and I will chat with you. You don't have, if you want to share screen, you can. I think it would be nice if I did, because I think then I could show people this.
Absolutely. Share your screen, bud.
All right, let me just go ahead and get back in there. Hold on a second here. Bring that up. All right, now you'll see all my open. All right, so you know me, I got things open all the time. I'm pretty sure people can make fun of it and be quite justified with that. So this is the form that you'll get as a result of this webinar. It's quick and easy. It might look like a lot right now, but I'm going to go through it quickly. And then you're welcome to constantly ask questions or follow up with me. But over my 43 years of active dental practice, I attended many practice management seminars, and this subject was included in all of them. Similar information is with and with some variations, all of them teach the same thing to dentists. I've learned from people like Linda Miles, Sharon McLeod, Jennifer DeSant George, Howard Ferran, Kathy Jameson, Bill Blatchford, just to name a few. So dentists have a long history of recall preventive care, and I have learned a lot over the years. So I'm going to share that with you. I and all of these people teach, though, one thing, and that is you must have a wow experience. We teach a culture of care, and taking care of patients is the core of everything that we do, and I'm sure it is for you as well. Some people call recall reactivation Recare. I think that's kind of a nice thing to call it a Recare, because it kind of implies that you're taking care of patients, and that's the reason for your recall, rather than just being a number. A recall kind of connotes the idea of recall on a car, which is defective, you know what I'm saying? So many people have learned to use the word Recare in dentistry. So that's what we're doing. The old worn out path, though, is sabotaging many practices. If you have a new patient, or let's say 24 or 25 new patients, and you look back the next month and you see that all of them are not reappointed with you, there's a problem. And dentists have the same problem. We have about 30, the average dental office has about 30 to 40% re-show rate. In other words, let's say in 6 months' time, we want our patients to come back. Now, I don't know about you, Tristan, but I've heard that chiropractors want patients to come back for maintenance every month. Is that correct?
Actually, typically, I mean, at the minimum once a month. A lot of chiropractors are of the philosophy and standard of care of once a week that you should be checked at least.
All right. Well, I'm going to go on the premise of once a month just for calculation purposes here. Okay. So let's say you have 1,000 patients in your practice. Let's say 1,000 patients, and you and by the way we calculate this index that I'm going to show you, the way we calculate it is We take, and you look back into your records, and over the last 2 years, if anybody has shown up, and this is for unique persons, not unique, in other words, not a person with multiple visits, but every single unique person who has shown up in your practice in the last 2 years, we consider them an active patient. Now, you can use your own calculation, but that's what we do in dentistry. So let's say in 2 years' time, we've seen 1,000 unique patients. And then we look at our 6-month Recare program and we count up the number of unique patient show-ups in the last 6 months. And we divide that number by 1,000. So if we have 200 people show up in the last month in our active list, then we got a 20% recall rate. That makes sense?
Makes perfect
Yeah.
sense.
So in dentistry, that has been traditionally around 30 to 40%. Now, if you have 1,000 patients in your practice and you want to see them once a month, not just once every 6 months, but once a month, and you notice that last month only about 100 came in, then you've got a 10% reactivation or recall rate. Okay, that's how you figure it out. And so that's what you do when you do these calculations. You must have a metric that you can measure, and that's what we recommend. So we recommend, first of all, that you count up all the unique patients in the last 2 years, and then you divide by your monthly recall rate and those people that have shown up. And if it's 10% or 20%, then you'll know what your starting value is. Now in dentistry, in the companies that I work with, we got our recall rates for 6 months up to 85 and sometimes even 95%. And it's a huge thing, because once you do that, you have a lot less issue with, getting new patients into your practice, which are more expensive to do than if you activate. And I'm going to show you a way with this app here called In Hand Health and Dental. By the way, they're going to change that name to In Hand Health for both. These are the apps that are showing up on the phone. But I'm going to talk to you, first of all, about the way dentists do it now, and then how we're going to enhance not only dental and chiropractic offices, but all practitioners in healthcare with these apps for enhancing your recall and reactivation. And by the way, Recare or recall and reactivation are kind of the same concept. The only difference is if you have somebody appointed and they're already in the books, it's a lot easier to bring them into the office than to call somebody up who's not on the books and reactivate them. And some of the best enrollment techniques I've learned are from the Black Diamond Club and some of these practitioners that I told you about above. Okay, so here's a cardinal rule. When a person gets done with their appointment and they leave the office, write this down. There must always be an appointment when a patient leaves the office. In other words, before they leave the office,
100%.
must have an appointment. I don't care what it's for, they have to have an appointment. This is a very, very important cardinal rule, and you need to put it into place, whether it's every 3 months, every 6 months, or every month, whatever it might be. Okay, you must have them appointed. So I've already talked to you about how to calculate the effectiveness rate, and we did that calculation just a few minutes ago. Okay, now, so what does it create? What kind of opportunity does this create? It's an enormous possibility. If it's been done before and you can get an 85% recall rate, then it can be done again. And it has been done before, so it can be done again. As the old saying goes, if it's been done before, it's probably possible. Okay. The next move is to get a team player on your team to take and become a volunteer to source this reactivation program or recall program. And you can ask your team and let somebody decide that they want to do it. I wouldn't just appoint somebody. I would actually have that person on your team, him or her, raise their hand and volunteer. You'll get one, believe me. And you want to create an incentive program, because if you get your rate from 20% up to 50%, that's going to be a huge difference in your practice. Now, what dentists do is we just add a hygienist to our schedule, and the hygienist sees these patients. So it really doesn't create a lot more doctor time. And the same thing can be done with you if you use this app that I'm talking about at the end of this lecture. Okay. So, but her role is this: one, she is to evaluate what's missing. She needs to set a goal of 70 to 90% of reactivation, and it needs to be done every day. Two, she must create a plan. How specifically will we accomplish addressing what is missing? Each person has a number who is a member on your team. It must be a reasonable and effective number. Serve people is the mindset. Serving the patient is the mindset, not increasing income. The increased income will come, but your mindset should be about taking care of patients. As of course, that's what we're always about. If the leader declares her goal first, then, and she asks the other team members to declare their goals, that'll help a lot, because the leader needs to take the forefront of making a goal. So let's say she wants to activate one person per day or two persons per day, and each person on the team does that. If you have 5 people on your team, you're looking at 10 reactivations per day. Imagine that. That's a huge number, and it can really impact not only the care of your patients, but your bottom line. And then, of course, you must monitor this. And I would expect that you'd put a monitor on the wall in your staff room with a chart with each person's declaration, and then you chart and they see it. People will see it. Just the fact that it's sitting there on the wall in your staff lounge already motivates people, because they're going to look at it every time they go in there for coffee or a donut or whatever they're doing. Okay. And then that source person must coach the stated goals, not in a harsh way, but in a supportive way. Okay, so what is the call like when you call a patient? Okay, let's say they're not in the system and they're not on the schedule. Well, first of all, you want to do this. You want to review the chart before the call. Reviewing the chart is important, because first of all, you're going to see what the problem is. If it's an arm injury or a back injury, then you want to be able to address the actual issue and what you're calling them back for. People don't want to come back for your time for your recall. They want to come back mainly for a specific reason. So if you mention, Mrs. Jones, remember that tear in the cuff around your shoulder, we want to make sure that that's healing. So we noticed you're not in the schedule, and we are concerned because we thought you were in the schedule. We noticed you weren't, and we want to bring you back. So you need, and also in the records, I would recommend that you actually write some personal things about that patient in there. How many children they have, whether they like sports, if they have pets, if they're a coach at school. You want to establish that as a way of establishing rapport. You can spend a couple of minutes or a minute just establishing rapport, and then say, well, what I'm calling about, and then you need to tell them what you're calling about. They want to know. And then you tell them about the specific reason, and then you go through and ask them a point. If you do this, you're going to notice that about 50% of the people you call will actually schedule on the books. And that's the last thing you do. You put them on the book, number 4, and you appoint them. And then you celebrate. I want you to celebrate each week that you make your goals, and the staff needs to celebrate. I don't know what kind of celebration you do, but I believe also in part of the celebration should be a monetary reward for the staff members that are hitting these goals. What does this mean financially? It's far more profound to have the patients taken care of than the dollars produced, but the numbers will come in. Now, to finish this up, I'm going to talk about how we've enhanced this now with what I call the Gummy app, which is just a name that I selected, because this app that we're talking about, In Hand Health, is, and I'm just going to show you that app again. These are the apps. This is the one that is on your phone that you monitor patients with. This is the app that the patient has on their phone. You can look in here every day and see with a color coding which patients are complying and which ones are not. Now, you can have any kind of prescription in here you want. By the word prescription, I don't mean drugs. I mean whatever you've told them that you want them to do as far as home care. And so you can go in there and you can create any kind of home care regimen that you want. And the patient is prompted by a push app or a push notification to respond every day or every week, whatever you decide, whatever interval you want. And they can tell you whether they're complying with the instructions you've given them. You can see immediately, rather than whether your patient's getting cold and being gone for a year and a half, and it's much more difficult to enroll them back. You can know right away if they've fallen off the wagon and actually talk to them. As a matter of fact, you can do it through a HIPAA compliant portal on the in-hand app, and you can actually talk to the patient face to face in a HIPAA compliant portal. They can post messages to you through that portal, give you screenshots of their circle ring results or their sleep studies, or whatever else you're having them do as far as weight gain, home exercises, sleep monitoring, whatever that might be. So I'm going to just say a few more things about this app and then we'll be done. This app exists and is called the In-Hand Health. Patients pay you to have this app. So not only is the app there and allowing you to free up chair time or table time in your office. In other words, you can make an income and you can actually expand the size of your office without spending $1 on remodeling. You can actually double the space of your office by just having real estate on the patient's phone. This is real estate on the patient's phone. And let's say they become inactive and they don't want to subscribe to anymore. Your app is always there and it's available for you to actually contact them when you need to. By the way, patients want this kind of care. They want to feel like they're close to the office, close to the doctor, and are getting special care. Remember that wow experience I talked about. This is part of the wow experience, and they'll actually pay for it. Sean has actually suggested to me, and I'm just excited as I can be about what Sean said, is that he says that you should have the patient pay for access to your office at $250 for 2 years of access. I think that is brilliant. At one time, I was saying, you should be billing the patient $10 a month. I like the idea of what Sean said better, $250 for 2-year access to you. This now gets the thing done and over with. They're not reminded each month that they're spending $10 with you. They are actually committed for 2 years. You're committed for 2 years also by saying that you're going to take care of this patient, and you can have a staff member monitor whatever they're doing over that next 2 years. Most of this can be done by your staff. This app is HIPAA compliant, as I said before. You can do synchronous video calls immediately to enroll, or just make sure the patient is doing their home regimen that you told them to keep. This app requires the patient to tap a few strokes on the compliance graded scales so that you can instantly know whether they're doing and whatever they're doing and what they're doing, whether they're doing some of the things you told them to, or not all of the things, or all of the things. And you can look at the app and you can see if they're green or red, and you'll know immediately who's complying and who's not by just a glance, and your staff can monitor that. This app is paid for by the patient, and it not only becomes a no-cost way of keeping them in relationship with your office, but actually becomes a value-added item and income center for your office. It is a recall system that pays you to increase your patient recall effectiveness rate. So, I mean, imagine that. So not only is it going to increase your recall effectiveness rate, but it actually is an income source as well. It's amazing to me. It's an app that instantly tells you when a patient is falling through the cracks, and you do not have to wait to find out later and reactivate them when they're cold. It's an app in which you can place any routine you want or record a video instruction for a patient, and it's completely versatile. And last of all, is a tool now being used for remote patient monitoring, and is already being used to justify insurance and Medicare remote patient monitoring and the financial benefits of that, and insurance benefits and Medicare benefits. So it's just a win-win situation. So that's in a nutshell, Tristan, what I do and what dentists do. And of course, I've added this now. This is not something I had in my practice, but we are really, really excited about this new In-Hand Health to actually accentuate what we've done. And by the way, it kind of acts like a hygienist in the dental office, because, for you, you don't have, I don't know that you have a hygienist in your, or a similar things to a hygienist in your chiropractic office, but by what we're doing is freeing up doctor time and yet increasing production. That's the ideal, right?
Yeah, there's some offices out there that have spinal hygienists, they
Well,
call
there
it,
you
which
go.
is, yeah,
Okay,
it's
so what
great
I'm
for this.
saying to you is that can be done with this as well, and for dentists as well. We can increase our real estate office size with virtual health. So that's what I'm talking about. So I'm back here now. And by the way, that form that I just showed you is available to all of you who want to, who have subscribed to this Recare Reactivation program with Tristan and Sean and me. And I think it's going to be real valuable for you in your practices.
Perfect, Rick. Thanks for coming on today, brother. This is great, guys. Highly suggest taking advantage of this sheet, this document, and also checking out the Gummy app. Hands down, I was talking to a couple chiropractors the other day about this, and they're like, we're talking about personal injury. If you're looking to increase the compliance as well, it's just fantastic. So there's multiple wins with this.
Yeah.
Thank you so much, Rick.
Yeah, you're welcome.